Welcome to 5-Minute Fundamentals. This short lecture provides an overview of key concepts from Pearson's medical language, Immerse Yourself, by Susan M. Turley. Please note, this is a brief summary. It's not a replacement for the full review. For deeper understanding, examples, and practice, be sure to read the textbook and explore the complete resources available on Pearson's MyLab. Now, let's scrub into today's 5-minute focus. The cardiovascular system is the body's essential transport system for blood, oxygen, and nutrients. It is made up of the heart and blood vessels forming a continuous circular pathway. The heart sits in the mediastinum and is enclosed in a double-layer membrane called the pericardium. The epicardium lies directly on the heart, while the parietal pericardium forms the outer layer. Between them, the pericardial fluid prevents friction. The heart's muscular wall is the myocardium, which contracts in response to electrical signals. It's thickest on the left side, which pumps blood to the entire body. The heart has 4 chambers, the right and left atria on top, and the right and left ventricles below, and they are divided by a central septum. Blood flow through the heart is controlled by 4 valves: the tricuspid valve, the pulmonary valve, the mitral valve, and the aortic valve. Chordotendinia anchor the valve cusps and prevent backflow. The classic lub-dub heart sounds comes from these valves closing during the cardiac cycle. From the heart, blood moves through the blood vessels. You have the arteries that carry the oxygenated blood away from the heart, capillaries that are those tiny vessels where gas and nutrient exchange occurs, and veins that return the deoxygenated blood to the heart. Now let's talk about those heartbeats. They're powered by a conduction system, starting with the SA node, which is the heart's natural pacemaker. The impulse travels through the AV node, bundle of His, bundle branches, and Purkinje fibers, causing that coordinated contraction. Now we're going to look through a few common cardiovascular diseases, starting with the heart. You have acute coronary syndrome, angina pectoris, cardiomegaly, cardiomyopathy, congestive heart failure, endocarditis, mitral valve prolapse, murmur, myocardial infarction, pericarditis, rheumatic heart disease, and many congenital abnormalities. In the blood vessels, you can see an aneurysm, arteriosclerosis, atherosclerosis, a bruit, coronary artery disease, hyperlipidemia, hypertension, hypotension, peripheral artery disease, phlebitis, Raynaud's disease, and varicose veins. Moving into the conduction system, you see many different arrhythmias, like bradycardia, fibrillation, flutter, heart block, premature contraction, sick sinus syndrome, and tachycardia. Also asystole, and you can feel palpitations. Common laboratory tests include cardiac enzymes, creatine kinase, lactate dehydrogenase, C-reactive protein, homocysteine, lipid profile, and troponin. Diagnostic procedures include cardiac catheterization, cardiac exercise stress test, electrocardiography, electrophysiology, Holter monitor, and telemetry. Radiology and nuclear medicine procedures include angiography, arteriography, venography, echocardiography, Doppler ultrasonography, multiple gate acquisition scan, and myocardial perfusion scan. Common medications include ACE inhibitors, antiarrhythmics, anticoagulants, antihypertensives, aspirin, beta blockers, calcium channel blockers, digitalis, diuretics, lipid-lowering drugs, nitroglycerin, and thrombolytics.